Jason Jones. I'm with the Set Family Medical Clinics. We are a partner here at Catholic Charities. We run the clinic here from 11:30 to 1, Monday through Friday, so that patients can come in and get medical care while they come in and get other services as well. It's always different, honestly. We see so many different things here. You know, we can see things from like asthmatic patients coming in, or people with small cuts and wounds, to someone having chest pain and shortness of breath, where we have to call 911 and get them out of here. So it really varies. I typically have a volunteer provider and a volunteer nurse here Monday through Friday providing the care. So they can make the decision whether, you know, they can be seen here for something minor, or we need to send them on to like an urgent care or an ER. We do some medication fills so that, you know, if people are in between medications and they, you know, they don't have an appointment with their provider until next month, we can provide them like a month's worth of, you know, medication to get through to their appointment. So we do a lot of that, and really just trying to treat whatever we can, you know, whatever presents to us on a daily basis. I've been doing this 10 years, so I've been coming here for a long time. A few things that have changed is that they don't do clothes anymore, so a lot of clients will come in looking for that service that used to be here. So we have to just inform them on what their other options are for getting clothes and things like that. So I guess I think what my volunteers state the most surprising thing is that there are other services here besides the food. So the fact that they can come get medical care, the fact that they have housing case managers, people who can help with ID, you know, getting IDs and things like that. They can get their mail here, all these other services. Plus they have partnerships with people who come from, that can help with Medicare, disability lawyers who can help with SSI claims. So there's a lot of different services throughout a month that people can come get. I think a lot of people don't realize that. I always think of this one time a patient came in. It was close to 1 o'clock. Actually, it was just after 1 o'clock. And we close at 1, so most people had cleared out. This one guy was coming in though, and he came in and he said, "I wanted to talk to you. You know, I know you're medical. I wanted to talk to you about something. I've been hearing these voices for a long time now, and now they're actually starting to tell me to do bad things. And what do you think I should do about that?" And he presented very normally, what you would consider normal, you know. And so I said, "You know, what else is going on in your life?" You know, and he explained, "You know, I've been doing meth for the last 30 years on a daily basis." And so I said, "You know, that typically it sounds like schizophrenia, but there's also a thing called drug-induced psychosis, where doing this meth and things can induce these kinds of things." And, you know, he did mention that he had sought treatment with like Aspen Point before. They didn't really want to see him because of the drug use, which makes sense because they can't really diagnose you know, while you have this going on. So I kind of explained that, you know, you're going to have to get sober to really address what these issues are, you know, to find out if it is the drugs causing it or if it's actually schizophrenia causing these voices. And so we had a long talk about that, and that was the end of it. He left, he said thank you and left. But it was about 7 months later or so, he came back during normal business hours, and he just came back and he's like, "I wanted to say thank you. I've been in treatment for the last 5 months, so I've been sober. I'm on schizophrenia medications." He had a little dog with him, so they got him a companion animal, and he was in an apartment. So he had done all this for himself, but he just said he came back and he wanted to say thank you for giving me that advice. And that always stuck with me, you know, that story and that person. I still see him from time to time, and he's still doing well. So. Just do it. don't make any excuses. Just come down and try it. Even if you do, volunteer in the kitchen, you can volunteer on this side where they do the services. Just try it once. If you don't like it, you don't have to do it again. But I think you'll find it's a great experience, and you'll definitely learn something about other people, maybe about yourself.